Thank you very much, Prime Minister. What you've announced today suggests that the pandemic is beginning to become under control and we may be past the worst of the crisis. Where do you think it would be reasonable and not irresponsible then for Scotland to hold a second independence referendum? And for Professor Whitty, your slides showed that the number of cases of the Indian variant have doubled in the last week. Are you at all concerned this could destabilise the lockdown easing plans and could lead to a further lockdown in the autumn?
Well, Seb, on your first point, I had good conversations with all the heads of the devolved administrations, and I can tell you everybody was resolved that the number one priority for the whole of the UK was to build back better, come out of the coronavirus pandemic and build back better together.
On the Indian variant, I mean, in fact, there are currently 3 Indian variants, but the one that we're worried about at the moment in the UK is the 617.2. It has gone up very sharply, and I think that's a reason for us to be very careful about it. And there's a lot of work being done by Public Health England to try and delineate where it is and to work out ways by testing and isolation we can get that on top of get on top of the curve of that. India has also gone into the red list, which means that new people coming in will have been significantly reduced. But I think what in answer to both your question and to the previous one, what we know is with all the variants that things can come out of a blue sky. You're not expecting it, and then something happened. That happened obviously with the B117, and that has happened to India with this variant as well. So I think it would be very imprudent to say it is impossible. I think at this point in time, I think our view is that this is a highly transmissible variant, at least as transmissible as the B117 variant. It is possible it is more transmissible, but we'll have to see at this point in time. At this point in time, our view is it is less likely to be able to escape vaccination than some of the other variants, particularly the South African one, but the data are not properly in there. So I think it is, we need to be cautious until we've seen clear data that give us an answer one way or the other. The reason I've given that as a relatively technical answer is, of course, we don't know whether this is going to cause significant problems in the autumn. The way to deal with that is identify the cases, which have been happening, isolate where we can, which is also happening, get through the rest of the vaccination programme and ensure that we have the capacity to pick these up and also to revaccinate as necessary when the autumn comes. The final point on this is the way to prevent, minimise the number of variants that circulate is obviously get on top of this as a global problem. And that is something which all of us are absolutely determined to support.